There are multiple big unanswered questions in AML. I think for me, the first unanswered question is, should we start thinking of AML as biological entities rather than relying on morphology? And I think more and more we are moving towards that direction as we get more understanding of the biological mechanisms and as we find more targeted agents against these biological mechanisms. The other questions are, can we try to move away from chemotherapy? Of course, that's something that's not immediately possible, but I think, again, that's something that we can actually see in the future when we have effective low-intensity therapies, and especially in patients who need to have an allogeneic stem cell transplant in first remission, it may be a wise choice to use effective low-intensity therapies and then moving them into transplant. And finally is how to avoid relapse in the future, and perhaps maintenance therapy is one of the ways we can try to do that.